All right, I'm here with Rick today, and again, I want to demonstrate more of what neurological integration looks like in actual practice. So, Rick's come in today, and why don't you tell what you're dealing with, Rick?
I got a chronic lung issue. I had pneumonia last Christmas, and then I've also got a diverticulosis going on in my digestion.
You have pain there?
It can get there, yeah.
Yeah, okay. All right. So we're going to investigate a little bit, see if his body will give us some information about what's behind these symptoms. So I'm going to ask you to lie on your back. So again, I'm going to keep repeating this, but we want to really emphasize the point that the muscle test in neurological integration is a neurological test. It is not a strength test. So if I have him bring his arm up here, now Rick's he looks like a pretty strong guy. And I'm just going to ask you to match my pressure here, Rick. I'm just looking at whether this muscle locks in. Does the nervous system have control here? So I'm not pushing very hard, right? Mm-hmm. So this is nothing again to do with strength. He's a strong guy. And let's look at a couple things here, Rick. I'm going to ask you to touch right here. And I'm going to touch right here. You'll notice that and he just loses control right away there when I do that. And so this circuit, and you'll notice when I'm doing testing on patients that we're always testing at least 2 points. And there's 2 points to a circuit, 2 ends, 2 poles to the circuit. So when we touch those points and the body says it has no control, what this indicates is there's inflammation in an organ somewhere. And so let's take a look here. So you go here, I'll have him hold here. Let's check his lung point, and we'll do that. We can do it a couple ways. One would be to check the acupuncture point associated with lung, which is here. It's the first pulse point deep. I put a little pressure on there, and sure enough, it shows up. The other would be to actually test the muscles associated with the lungs, which are the posterior deltoids. So if I stimulate the posterior deltoid here, yeah, he's got no strength. If I stimulate the posterior deltoid here, again, no strength. And let's actually test those muscles directly, Rick. So bring your arm out to here, straighten your arm out. I'm going to pull up and you push down. He can't do that. He's got to use that posterior deltoid. Doesn't work for him. Pull up. So I'd also like to introduce a concept called reciprocity into this example. In the spine, all the joints are actually reciprocal with one another. And actually all the levels of the spine are reciprocal with one another. And you chiropractors have heard about this through what's called the Lovett brother relationship. So in this system, if we look, the lungs are associated with thoracic 3. The reciprocal to that is thoracic 8. Now thoracic 8 has an effect on the liver, and the liver is associated with the pectoralis muscle. So what we'll see here neurologically is that the reciprocals won't work either. So if we have him hold his arm up here, he turns his hand this way, I push out, he's got nothing on that pec muscle. We go over here, push, nothing on the pec muscle. So now we understand the big picture here, and this is really significant for you to understand that when these areas of the spinal column, and it's actually the areas of the nervous system that are under stress, none of the associated muscles will function correctly. So if we bring your arm up here and hold. Now let's go right here, Rick. I'm going to hold the lung point here, the pulse point for the lung. He's weak. We're going to ask his brain for some instruction on how to make the correction here. There it is. So it's telling us that these control points will get this back under normal neurological control. So Rick, if you could touch right here. What I'm going to do is I'll hold the pulse point. We're going to integrate all these together and see if we get some control back in the nervous system. And again, we want to remember that the integration process that we just did here over the postcentral gyrus is not an intervention. It is really just a reconnection of some points. The brain then goes through this incredibly complex cascade of events to start making these, reconnecting these neurological imbalances. So we go up here again. Let's go here. I'll do the lung point. We'll go lung here, lung here. Now, let that come off of here, Rick. Let's try the muscles again. So I'm going to push up and you hold. Now he's got total control over that muscle. Total control over that muscle. Let's check the reciprocal muscles, the pecs, right? So push in, Rick. Good. And over here, rock solid. So you'll see how quickly that happened. The brain made the correction. I didn't do anything other than assist in the brain understanding what was happening there. So let's investigate, since he's having some bowel issues, let's look at that. So if he touches here, and we go to the bowel point, which is the same pulse that the lung was on, except not as deep, and it shows up weak here. So I'm actually gonna, in this system we can use the pulse points, we can use the muscles, or we can go directly over the organ, which is what I'm gonna do now. So if I go over his ascending colon, he stays strong, his transverse colon strong, his sigmoid colon weak. So now, the sigmoid colon is associated with the second lumbar. The second lumbar is associated with the tensor fasciae lata muscles. So let's look and see what happens if we check his TFL. So go out here, push out. No, he's got nothing there. Try it again. Really give me some... No, he says he can't do it. Now, lumbar 2 reciprocates with cervical 4. Cervical 4 actually has some control over what are called the subscapular muscles, and we can test those like this. I'm going to pull straight up, Rick, and he's got nothing there. Let's go on this side. So again, have you been having a lot of like shoulder type discomfort?
I mean, some just cramping in the dorsals.
Yeah, cramping in the dorsals, which makes sense with what we're seeing here. So once again, if we go here, and I hold that large intestine reflex here, let's just look, see what the control point is. Hold, not there. Hold, not there. Hold again, no. No, lift your head up a little bit, hold. Now that strengthens him up. So Rick, I'm gonna have you touch behind here for me, head down. This one, we can actually, again, we can correct with the organ, we can correct with the acupuncture pulse point, or we can correct with the muscle, which is what I'm gonna do in this case. So I'm just gonna stimulate these muscles, do a little integration here. Stimulate the muscles, a little bit of integration. Good. Okay, let's see what happened with that. Let's go back to the pulse point. That's strong. Now, let's take your hand off of there. Let's see if these muscles have come back online. So bring your leg out like this, push out to the side, hold. Same thing here, push out to the side. Hold, total control. Feel different? Yeah. Let's go here, Rick. I'm gonna pull up. Yeah, let's go over here. We'll pull up. Beautiful. So this just shows the profound effects that happen in the nervous system when we've got a stress, in this case an immune stress, to the organs or glands.